Welcome to the Defeating Epilepsy Foundation YouTube channel. At the Defeating Epilepsy Foundation, our mission is to provide the advocacy and educational resources needed to the epilepsy community and our society. We are dedicated to removing the stigma associated with epilepsy and help to create opportunities for individuals battling epilepsy. In this presentation, we will discuss what occipital lobe epilepsy is, the functions of the occipital lobe, symptoms of occipital lobe epilepsy, different types of occipital lobe seizures, treatment for occipital lobe epilepsy, and quick facts to know. Occipital lobe epilepsy is characterized by seizures in the lobe of the brain that is primarily responsible for vision. There are two types of occipital seizures, idiopathic and symptomatic. Occipital lobe epilepsy often begins in early childhood, around 5 to 7 years of age. Occipital lobe seizures are typically characterized by bright flashing lights and visual changes. The occipital lobe allows us to see, process external stimuli, and assign meaning to visual perceptions. Examples are assessing distance, size, and depth, determining color properties, recognizing object movement, mapping the visual world, and reading. Initial symptoms of occipital lobe epilepsy are often mistaken for migraines. Symptoms begin with visual hallucinations such as blinking lights or rapid blinking. Symptoms may also include visual illusions, decreased vision, image repetition, eye pain, and involuntary eye movements. Some children may experience nausea and vomiting. Seizures arising in the occipital lobe are characterized by focal sensory visual seizures that are subjective experiences, leading to difficulty in diagnosis in young children. The primary visual cortex. Seizures in this area result in focal sensory visual seizures that may be positive visual phenomena or negative phenomena such as the loss of a part of a visual field or blindness. Bilateral loss of vision may occur, and this may be in the form of a blackout or whiteout. More complex formed visual images, considered focal cognitive seizures, are not seen in seizures arising in this area. The visual phenomenon is seen in the contralateral visual field to the hemisphere of seizure onset. If positive visual phenomena occur in a part of the visual field, the person may be seen to look in that direction during the seizure. It can be helpful to ask a young child to draw what they see during their seizure. Focal visual sensory seizures are usually brief, and which can assist in distinguishing them from migraine auras. Extrastriate cortex. Seizures in this area are associated with more complex formed visual hallucinations such as pictures of people, animals, or scenes. These are considered focal cognitive seizures. Parietal occipital junction. Epileptic nystagmus, also known as uncontrolled repetitive movements of the eye, may be seen. If seen, this is typically with the fast component to the side contralateral to the hemispheres of seizure onset and the slow component returning to the ipsilateral side. Eye movements typically occur with retained awareness and may be accompanied by head or trunk vision. There may also be eyelid flutter or forced eyelid closure. Inferior to the calcarine fissure, occipital seizures arising in this area tend to spread to the temporal lobe, producing focal impaired awareness seizure. Superior to the carcerine fissure, occipital seizures arising in this area can spread to the parietal lobe, frontal parietal operculum, or frontal lobes. Focal atonic motor seizures can occur if the seizure spreads rapidly to frontal regions. Anticonvulsant medications such as carbamazepine, levetiracetam, and lamictal are common drugs used to treat occipital lobe epilepsy. Other anti-epileptic medications may be used to treat focal seizures caused by occipital lobe epilepsy. Neurosurgery may be effected for severe symptomatic cases. Occipital lobe seizures originate in the back of the brain and account for 5 to 10% of all epileptic seizures. The occipital lobe controls the patient's visual system. Occipital lobe seizures are often mistaken for migraines. Seizures beginning in the occipital lobe are rare. To learn more about what occipital lobe epilepsy is, please check out our resources used in the presentation today. Please like and follow us on our social media pages and subscribe to our YouTube channel. Thank you for your support, and together we will defeat epilepsy.